The Patient Protection and Affordable Care Act was a long-awaited effort to extend health care to many Americans not covered by an employer or other private plan. President Barack Obama signed the act into law on March 23, 2010. The law had several goals: improving quality and lowering healthcare costs, providing greater access to healthcare, and providing new consumer protections. Let's take a look at the employer shared responsibility. Some of the main features of the law included ending pre-existing exclusions, requiring employer health plans to cover young adults up to age 26 on their parents' plans, ending lifetime limits on coverage for all new health insurance plans, limiting administration costs by insurance companies, and providing certain types of preventative care at no cost. Different parts of the plans were scheduled to start at different times. Employers with 50 full-time employees or a combination of full-time and part-time employees equal to 50 full-time employees during the previous calendar year are required to be in compliance under the Affordable Care Act's employer shared responsibility provisions of Section 49080H of the IRS Internal Revenue Code. Employer shared responsibility provisions requirement under the Affordable Care Act for employers with equivalent full-time 50 employees or more to offer affordable health care coverage to their full-time employees and their dependents or be subject to an employer shared responsibility payment under certain conditions. For purposes of the Affordable Care Act, a full-time employee is someone who works on average of 30 or more hours per week. Employers who meet the requirements to comply with the Act are known as applicable large employers. Under these provisions, employers will need to offer affordable health coverage to their full-time employees and their dependents, or they may be subject to an employer shared responsibility payment. The health coverage offered by the employer must provide a minimum level of coverage. It must be offered to 95% of employees if the employer has 100 or more full-time employees, and offered to 70% of employees if the employer has 50 to 99 employees. The coverage is considered affordable as long as the employee's share of the cost of the coverage is less than 9.5% the employee's annual household income. Employers may be subject to the payment if at least one full-time employee is receiving a premium tax credit because he is purchasing individual coverage in affordable insurance exchange, otherwise known as a health insurance marketplace. These provisions apply to for-profit, nonprofit, and government employers.